So I found this post on Reddit. It is in the Anxiety Help Forum. It's written by Intelligent Check 89, and the post reads, "High blood pressure only with anxiety." So it says, "Need advice. Hello. I seem to be dealing with anxiety-related hypertension. My average blood pressure when not worked up is somewhere around 127 over 84. With spikes, I can get up to 150, 160 over 105. Okay, yeah, so kind of 135, 140 is the cutoff, and they're above that 140 range. So yeah, this is definitely hypertension. I'm 50 years old, but in good fitness. I have a good diet and overall decent health numbers. I've been dealing with anxiety more so lately, and I'm now getting anxious about the blood pressure readings, which is not helping. I do not have a high pulse rate, which is 60 to 65 when calm, 80 to 90 when very worked up. I have several doctors suggesting different blood pressure meds, and I'm trying to get a gauge on what has helped with anxiety-based hypertension. My understanding is metoprolol will deal with anxiety spikes, but could lower further my heart rate. Lisinopril won't touch the anxiety, but might be better tolerated. And Amlodipine is also being considered. My primary care physician has prescribed metoprolol, and I got a call from the pharmacy that it's ready. I will obviously discuss this with him if I have second thoughts or want to try something different. Just gathering feedback and experience here. Please do tell me. Thanks." So this poster has two advantages. The first is awareness. They acknowledge that they're having this feeling, this state of mind of uneasiness. They're having anxiety. And number two, they are tracking their blood pressure when it's associated with calmness, as well as when they're experiencing anxiety. So they're already at a very strong start and have a great opportunity to have a great dialogue with their doctor about this association with anxiety and high blood pressure. Now, I can't diagnose this person. I don't know this person's entire history, but I commonly see this in my patients as an anesthesiologist. Even after giving them medications that drop their blood pressure, the anesthesia that drop their blood pressure to go to sleep, their blood pressure will drop, and then even under deep anesthesia, again, no awareness of anxiety, no awareness of a trigger, their blood pressure will go right back up. And so, I have to now start giving blood pressure medications to lower their blood pressure. But quite frankly, getting someone to drop their blood pressure permanently during surgery is not a good idea. There's just so many factors that are going on under surgery. It's not the ideal time to start treating someone's blood pressure. So perhaps another element of this person's blood pressure that should be explored is the root cause of the anxiety, right? So this person has the advantage of awareness and tracking. So what if they could take that to the next level? What if they could explore, mental health expertise from a licensed medical or mental health expert to help them dive a little deeper into the triggers of the anxiety? So the first thing is to consider a licensed mental health professional to assist with trying to figure out what's the cause of this uneasiness. But more and more commonly, people are on the App Store looking for mental health apps to address common conditions like anxiety. And there are hundreds of thousands of these apps. So in my latest podcast episode, I give you the best approach to looking for these mental health apps. Certainly you want to pair this with the use of a licensed mental health professional. But if you're looking on the App Store trying to figure out which one is best, my latest podcast episode will give you some tips and some approaches to looking for the best mental health app for you. But kudos to this poster. The tracking and awareness definitely is going to send them in the right direction, and I wish them the best of luck. Subscribe to the podcast, join our newsletter to get more information.